We're trying to do is place really curated, customized education in the hands of these pregnant people so that they have a trusted place to go instead of going to social media.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster with Sarah Nicholson with Babyscripts. Sarah, it's always good to see you.
Good to see you.
So we got to talk at Vive in LA. Things are always happening with Babyscripts, and it's been great to watch your progress. I think Babyscripts has been a part of Startup Health for many, many years.
Yes.
It's been evolutions in the product, and so I want to hear about that. Why don't you just level set with us, though? What is Babyscripts in 2024?
Sure. So we're a virtual maternity care platform. It's through your provider, and it's really mobile education, assessments, earlier risk detection, and remote patient monitoring. It's something we've been doing for about 10 years, so we have a really good expertise, but we're continuing to try and evolve the program to better meet the needs of moms in this country.
Yeah. You were early with virtual care for maternal health. How have you seen that market shift in 10 years?
Well, we definitely have many more players in the space. It's still challenging to figure out how to maintain compliance for a patient through 10 months of pregnancy and postpartum, but it's really exciting to see the growth in the market and that there's more clinical acceptance of these tools to be paired with the standard pregnancy care.
Interesting. Yeah, how have you seen, I'm curious about how patients see your tools differently. Maybe at the beginning you had to sort of convince them that virtual care was okay, and now we've had COVID, we've had, the boom in telemedicine. How have perceptions shifted?
I think patients expect a lot of these tools in their care, especially when you're talking about kind of this like Gen X, Gen Z even, that we're getting younger and younger women coming on to this platform. They're expecting technology. They're expecting education, connection with their provider. They're expecting tools to better understand what's going on in their body. So I think it's actually a really prime space for these tools, and I don't think there really is a learning curve at this point for something like what we offer.
You mentioned Gen Z. I've been reading a little bit about their attitudes and desires for healthcare, how some are kind of pushing back towards in-person, or it's sort of like virtual care is sort of reminding them what they love about in-person, so they're kind of picking and choosing. Are there any other sort of trends that you're seeing in younger folks on the platform?
Well, there's some pretty staggering statistics that have come out recently about trust in healthcare providers versus social media. That's something it's a little bit concerning to see that a lot of people trust the TikTok education. And what we're trying to do is place really curated, customized education in the hands of these pregnant people so that they have a trusted place to go instead of going to social media for a lot of the education around what's going on in their body.
Yeah. So I know early on, a lot of emphasis was like making sure women had a way to check their blood pressure while they were at home. But now you've grown and there's a big emphasis on mental health. So tell me about kind of what the broader, more holistic care looks like.
Sure. So we really want to be a platform to identify risk earlier and intervene with the appropriate stakeholder or the appropriate program. And so that can be in the form of blood pressure monitoring, that can be in the form of mental health monitoring. And so long as we're identifying that risk earlier and triaging that to their midwife, their OB, a mental health provider, or a virtual mental health provider, that's really what we want this whole system to be. That can also play into social determinants of health. One of the exciting things that we've done recently at Babyscripts is we partnered with Lyft Healthcare, and we've identified transportation insecurity for women being able to get to their prenatal and postpartum visits. And so we've offered free rides to women in the DC area right now. We've given over 800 rides, and we have so much positive feedback from these women saying, I'm never on time to my appointments. This allowed me to get there without stress. I was able to manage my kids and take them with me. So there are a lot of great benefits that we're able to deploy through our platform. So it can be a lot of social risk and clinical risk.
That reminds me how I really love how there's some virtual care platforms that really become an on-ramp to more care. Once we've got you in the system here, you're having a child, you're on the system, you're starting to check your blood pressure, you're starting to check in about your health. Now let's talk about transportation. Now let's talk about mental health. How are you seeing Babyscripts become an on-ramp to greater holistic health?
Well, I think if we can be that trusted, digital front door and platform for pregnancy that's coming from their provider, and then plug into other great services, great companies who are doing other, things that maybe we don't specialize in. There are some wonderful organizations that are here that do maternal mental health, that do lactation, that do doula services. And Babyscripts doesn't do those things today, but we can use our platform to plug into some of those other services.
I know your tagline is better pregnancies, I think. So I'm sure you have a lot of sort of great success stories on the platform, every successful birth. I wonder, what do you think about, is there a patient, is there a story that you think about when maybe you hit one of those inevitable startup slumps when things are kind of tough that kind of keeps you going?
I get the opportunity to see a lot of the patient stories just by the nature of my role. And so just hearing a patient say, you made my appointment easier. You saved my life. We hear that a lot, actually. It's quite motivating to have stories like that.
Do you hear things like that? I'm not asking how often you save lives, but how often do you...
We do standard surveys, and we'll check in with a lot of those patients to do more formal interviews. And a lot of patients really feel like, because it could have been a trigger in our system, it could have just been that they were educated on some of these issues. They felt that they were in better control of a situation in their health, and that we provided that support to them. So that's really, really motivating for us to hear. And that honestly keeps me going, my team going, the entire Babyscripts organization going. So
what's next for Babyscripts?
So we are really investing in adding a services layer into our program. It's very clear that there's provider burnout happening across all areas of healthcare, but especially OB. And so if we can take on some of the more human touch elements of our program, we can take that off of our providers. So we've invested in OB-specific care management staff who can support a lot of our high-risk programs, do a lot of the coaching and the mentorship, and ensure compliance for our programs, and take that off of the OB staff.
So just so I understand, so actually moving more into the in-person care? Into the OB's office and helping them out some more?
Not in the OB's office. So it's being done virtually, but we actually have staff, Babyscripts staff, who is checking in with our patients, making sure that, if they have a high reading, they know what to do about that.
Okay, it's the services, it's the wraparound services for the OB's office. You already had the relationship, and you're like, I think we can actually make you more efficient.
Correct.
Than you were before. Very interesting. Okay, that's cool. Well, Sarah, I always appreciate the updates, and we're excited to see where you guys go next.
Thank you. It was great talking to you.
Take care.